Hi, Tony. Thank you so much for joining us today.
Good morning, Meg. Thank you so much for having me. I'm excited to be here.
Yes, well, I'm excited to dive into this. We have not had any dentists on the show yet. So, this is a whole new topic, which is something that can apply to everyone. So, I'm excited to talk about this because I know there's a lot of questions surrounding what even is a biological dentist. Fluoride's huge, so I can't wait to get into the ins and outs of fluoride from your perspective and all the things. But let's just start with you actually talking a little bit and letting us know what a biological dentist is and the kind of what that is, how that may be different than the dentist you're seeing today.
Absolutely. So, a biological dentist is really, in practicality, it's kind of the dental equivalent of your functional medicine doctor or your naturopathic doctor. It's a more holistic, integrative treatment philosophy when it comes to dentistry. Now, we still do all the normal things, just like a functional medicine doctor can still write a prescription. I still do fillings and crowns and remove teeth and do all the things, but how I do it is very intentional with a mindset of we want to prevent first and then treat only if necessary. So we want to give you the tools to actually get well and to get to the root cause of your oral disease, whatever that might be, whether it's tooth decay, gum disease, or any of the above. And then when we are having to do actual dentistry, the what we always term it the drill, fill, and bill part of dentistry that burned me out really quickly. When we do have to do procedures, we're very intentional of your entire biological terrain. And so that means minimizing toxins wherever we can, using materials that are as safe as possible. Nothing in dentistry is really natural per se. A couple of things you could say are natural. But we just want to make sure that things are as safe as possible because I was taught and really strongly believe in the oath that I took to first do no harm. And so I want to make sure that the dentistry I provide is first doing no harm and then hopefully doing some good.
Yes, well, that's what we want for sure. Let's start with fluoride because I know that's something that's a big topic that, we're educated incorrectly a lot of times. I mean, I'm using a fluoride-free toothpaste, but I still have this like back of my mind, like you should have, are you doing something wrong? Like, are your teeth going to get bad because you do this? Even though I know it's the best thing for me, but it's still, I think sometimes we've just been so ingrained in fluoride and the importance of fluoride and have to have fluoride for healthy teeth. And so let's start there.
Absolutely. And you're right. It's a huge topic that we could go 10 different directions probably and talk for 10 different hours on. Um, but just at a very high level, fluoride was a great tool. It was a great tool to be used to help reduce tooth decay. And it is effective at reducing tooth decay, but it was absolutely overstated. And I think has been overstated in the science for a really long time. Um, they started adding fluoride to our water supply when they realized that it was found naturally in some different areas, found naturally in the water, and that those areas, the people in those areas tended to have less tooth decay. And so they started putting it in the water, around World War II era, and noticed that decay rates started dropping. Well, what's really interesting is that if you look at other countries that did not add fluoride to their water, they had the same drops in tooth decay rates. So it's really, while we were taught, and the CDC actually still says that water fluoridation is one of the best health advances of the 20th century, but they don't mention the fact that tooth decay decreased everywhere, not just where fluoride was added to the water. So, okay, maybe we can't attribute these lower decay rates completely to fluoride like we thought that we could. And so, what we're learning is that fluoride is actually not necessary. It's not an essential nutrient. It's not necessary to prevent tooth decay. You know, there are a lot of things that cause tooth decay, but it's not from a deficiency of fluoride.
Mhm.
And so that's kind of where we are and where my practice differs from a lot of my colleagues. You know, we've known for a long time that fluoride applied topically is more effective than fluoride taken internally. And so even my mainstream colleagues will say, yeah, we don't need to be drinking fluoride in order to get the benefits. It's primarily the topical benefit. And so if that's the case, if we don't need to be drinking our fluoride, if we don't need to be ingesting it, then why are we? And what are the effects that happen on the back end that maybe have been minimized or ignored or that we've kind of turned a blind eye to over the years? And that's where things have gotten really interesting, where fluoride and science and dentistry and the EPA meets the legal system. And so this is actually a a very current, it's been an ongoing lawsuit for the last several years. And so I don't know how much you've heard about it because it hasn't been in the news a ton, or how much your audience has heard about it. But there is actually a nonprofit group that filed a lawsuit against the EPA because there were studies that were showing that fluoride is potentially not good for our kids, specifically in regards to IQ. And so that's kind of what's been in the news lately and has been exciting to see it get a little bit of attention, although not nearly as much attention as I think that it should be getting. Um, you know, there was a study done by the National Toxicology Program, and that's, you know, a government funded, um, not organization, but it's a government funded program. And in that National Toxicology Program, they did this meta analysis, this study of studies. And it did show that when you look at areas with higher levels of fluoride, that was directly correlated to a lower IQ in children.
Mhm.
Now,
That's
I don't know about
interesting.
you, but that, for one, that's terrifying that we've been exposed to this for so many decades. And also just really infuriating because I can remember, I mean, I'm not that old, I'm in my 40s. Um, so I was in dental school not too terribly long ago. Um, and in dental school, I was taught that the people who said that fluoride reduced IQ, that was a conspiracy theory, that, you know, don't listen to those people. That's not real science. That's junk science. Well, it turns out it's not junk science and it's not conspiracy theory, that there actually is a correlation in the peer-reviewed literature, which is really hard to come by
Mhm.
when we're talking about something that's been ingrained in the way we practice for so long.
Okay, so what was there's a lot of things to unpack here, but what was the outcome of the lawsuit?
So the outcome of the lawsuit finally, because that NTP, that National Toxicology Program, that study was actually suppressed during COVID. It was blocked from being released. So finally, the judge in the case said, okay, we actually need this information. And so the judge required that NTP report be released. And then once that was public, then the lawsuit was able to continue. And the judge ruled very recently, only about a month ago as we're recording this. And the judge ruled against the EPA in favor of this nonprofit group. And the judge said, you know, he didn't specify, he wasn't able to specify. He said, you know, we can't say for sure that fluoride in our water is harmful.
Mhm.
We just can't say what the safe level is. And they've determined that it's the EPA's job to protect the public and find what the safe level is and what the unsafe level is. And so the
That's
judge said, basically, we don't know what you need to do. You just can't do nothing.
okay.
And so
And
that's where it stands right now,
hmm
is that
that's a
the
big
judge
step,
will,
though.
it's a huge step.
Hmm
Um, I hope that it keeps going. I think there's still an opportunity for the EPA to appeal that decision and take it to a higher court. And if that happens, then we just hope and pray that there's a reasonable judge in that court as well. Um, because it is the EPA's job to make sure that anything that the public is exposed to is safe. And we need to know what exactly those safety parameters are.
And I think that that's just a huge point in general about water because it is antiquated how our water is being evaluated and tested, and that's what you actually drink. So about like maybe 5 or 6 years ago, I did, I'm always testing myself along with all the people that I work with, and I did a test on myself that were, so when we're talking about fluoride, we're also, fluoride, just a back step, fluoride competes with iodine, which you need for good thyroid function. So we also know that if we're having too much fluoride, then that can potentially affect your thyroid in a hypothyroid dynamic. So, but I was doing this test there were different, like fluoride was one of them. Like it was testing iodine. It was also testing like bromine and different levels. And so I actually went down this rabbit hole and like really tried to look into my water. I called the water company about testing. I was gonna because it was like I'm having some of these high levels. I'm like it has to be from my water, and then they say okay, no, they're all safe amounts or whatever. So I then got a reverse osmosis water filter. It was a while ago because I've had that for a while. But then I got a reverse osmosis water filter, and then it all my levels went down, and it's like, yep, clearly from my water.
That interesting. Isn't
hmm
that interesting? And I wonder what would happen if you took those test results
I
to
know.
the water company and said, okay, the only thing I changed was I filtered my water, and
Water.
here are the differences.
hmm
Um, Now,
Yeah.
obviously, I'm assuming that they would very quickly say they can't practice medicine.
I know that it doesn't mean anything
They're
and
not
that, yeah,
qualified.
no, yeah, to do that. But it was like a lot of different phone calls with people and it helped me understand, okay, the actual what's being checked. A lot of these are outdated, like you're saying, back in the 60s or, these requirements were set and things have changed and, nothing. So it's a really, water could be like we should do a whole episode on water. Like
We
do
totally
that
can.
because it is something that I think, and food, we're looking at water and food's not always regulated in the way that we assume that it's regulated. So, I guess you have to always be aware of what you intake. And we have some right now where we live, some of our own responsibility that we have to take. That's why I want to share all of this information because we have to take responsibility for what you're ingesting. So I want to move on to something very interesting here because you're mentioning that kids are the ones that, in this study, it's affecting children's IQ. Now, when you would talk to most dentists, they would say that fluoride is more important for kids. So that's an interesting thing there.
Yeah. I don't, is this a video podcast? Can
Yeah,
everyone
it
just
is.
see how much I cringed?
Yeah.
That hurts my heart. They even taught me when we were taking like very early, like right after graduation, and and I was part of a practice that treated patients with Medicaid. And so some of those continuing education classes that I took really encouraged us to use fluoride varnish, which is a very, very strong prescription, for dental office use only fluoride, to use it on infants before they even had teeth.
Oh, interesting.
Yeah, right. Well, and what's
Yeah.
crazy is that we can't, when it's in the water, and I mean, for sure, when we're applying it in the office, I feel like that's another thing altogether. We really can't control the dose.
Mm-hmm.
We can't control the dose. And if we can't control the dose, what are we doing?
Mm-hmm.
What, how are we practicing? And how are the water authorities practicing medicine if they're treating something, if they're treating an illness or a condition?
Yeah.
Um, then how is that not practicing medicine?
That's a good
And
point.
and then how would they control the dose of
Mm-hmm.
that? Because they're
Mm-hmm.
not controlling the dose. Um, so yeah, and I can tell you patients that come to me who are kind of new to this world and are hesitant at first to ditch the fluoride for their kids, especially if they've got kids that are cavity prone.
Mm-hmm.
And that's an ongoing issue for them anyway. What I can tell you, having been a quote unquote normal dentist that's how I was trained. Um, and to now having a practice that is a completely biological practice that's completely fluoride free. We have no fluoride in the office. I can tell you from personal experience that the rate of tooth decay among my patients is no different. It's
Okay.
no different. Um, and I have yet to see a family that dropped the fluoride that then had an increase in cavities, especially if they're doing it with us and we're guiding them through and we're showing them what tools work as well, if not better than fluoride. So, I just very strongly disagree with any
Mm-hmm.
of my colleagues who say that fluoride is more important in childhood. It's not important for anyone.
That's a good point. Can you tell us some, that would be a great thing to talk about, some of the tools people can use?
Yeah, absolutely. So the two primary things that we'll put our patients on is we'll do a remineralizing toothpaste that preferably has hydroxyapatite in it. And calcium hydroxyapatite is it's usually from either synthetic or cal source, but it is the crystalline structure that our tooth enamel is made out of. And so if you can get that ingredient in a small enough particle, then your tooth enamel can absorb it and take that in, similar to how they would take in the fluoride. But then you're creating more natural crystalline structure instead of this fluorapatite structure that happens when you expose the tooth to fluoride. And then a second tool that I want all of my patients to use, except in very, very few cases where they've got a really strong sensitivity, is I want them on a therapeutic level of xylitol. And xylitol with an X, if you've never seen it before, it's a plant-based sweetener that is similar in structure to sugar. And so the bacteria that cause cavities will ingest the xylitol, but they can't metabolize it. And so those bacteria will just kind of slough off over time. And over time, you'll shift the microbiome in the mouth completely. And so it works in two different ways. Um, it works in the short term by immediately raising the pH. So we have less of that acid exposure on the teeth. And then in the long term, by shifting the bacterial balance in our favor to where teeth are less prone to getting cavities. But in order for it to be that really effective dose, then we want patients using it 5 times a day,
Okay.
which is,
Mm-hmm.
it sounds hard at first.
Mm-hmm.
But it's really, really simple because it's going to be in most of the remineralizing toothpaste that we're using. So you're already getting it twice a day. And then, if it's an adult or an older kid, then I tell them, pick their favorite xylitol gum or candy
That's
to
what I was
have
gonna ask.
after meals.
Do you do
Yeah.
gum? Is that how would that be the way to get it?
That's one way to get it, but they
Mhm.
make all kinds of like little candies. There's a
Okay.
spray. When my girls were little and they were both in daycare and we were, rushing in the mornings to get where we needed to go, I would just take a little spray bottle of xylitol spray and I would stick it in my purse or in the car and just give them a couple of squirts on the way out the
Okay.
door.
Hmm. But I
So
mean,
it can
it's
be really simple.
especially because it's sweet. I mean, when we're talking, it's not something that's like hard. There's some things that you're like, oh, I don't want to do that 5 times a day. But if that's like take a little piece of candy or chew gum or do, it's like that's not a hard thing to add in necessarily. But you could get it from just a piece of like you don't have to get like a specific supplement or whatever. You can actually just go and get xylitol gum or something like that or candy or something that you can use.
Now I like if you get either specific brands and you're looking closely at the ingredients, um, or just to be safe, try to get it from a health food store instead of a big box store, because there's some bigger brands of cheaper gum that uses xylitol, but it's a corn sourced xylitol.
Oh.
Um,
Mhm.
and so it's usually going to be genetically modified because most corn is GMO corn.
Mhm.
But if you're careful, if you either pick it from a health food store or you use a brand where you know that they source their xylitol well, then they'll source it from birch trees typically. And birch is a much cleaner source of xylitol.
Okay. And will that say it on the label, or is that something someone would have to like research search?
You might have to research just a little bit.
Okay. And would you share, I know, like, because I know we're not like linked to any specific brands here, but your favorite tooth, I mean, the one question I get all the time is like, what toothpaste should I use?
Yeah. So I have, this is actually really, really encouraged because I feel like every 6 months there's another brand that has really good, clean ingredients that's doing well. But the favorites that I
Yeah.
carry in my practice are Risewell and we carry a lot of Boca because Boca has really interesting, cool flavors that a lot of my patients like.
Okay, makes it easy, especially with kids. Yeah, that
Yeah,
makes it easier. Yeah, because it's hard to find you want to do that, but I mean, I think that that's like another thing that happens is you're like, okay, maybe I'll get the fluoride-free toothpaste, but then if you dig deeper, some of the fluoride-free toothpaste still don't have all the good ingredients that you need. So you may be taking a step in the right direction, but not getting something that is really ideal too.
like a lot of people, their first switch will be off of fluoride onto like a Tom's of Maine or
Hmm.
something like that. And I always tell people, that's better. Um, Good that they're not using fluoride, but a lot of times for one, that particular brand is a little more abrasive. Um, and so sometimes that can be irritating to gum tissue. Sometimes it can make the teeth a little more sensitive. And it's they don't have the same requirements as a brand that
Hmm.
some of the other newer startups have, where they're still independently owned.
Hmm.
Whereas Tom's, I think, is now owned by one of the bigger brands.
Okay.
Where they'll still put sodium lauryl sulfate and other things in there that we just don't need.
Yeah. Okay. No, thank you so much. Another thing that I'd like to just briefly touch on, because I know it's another thing that people are scared about sometimes, are mercury fillings and how to safely remove them. Because, I know then a lot of people have those mercury fillings, but then you have to be careful in the removal because you can actually increase your toxic burden if you're not.
Correct. Correct. And this is where I'm so glad. And I always try to encourage my patients to make sure that they're working with a functional medicine provider, that they're working with somebody like you who can help guide them through the process. Um, because yes, you're absolutely going to be exposed to a tiny bit of mercury by
Mhm.
having those fillings in your mouth. Just normal eating, chewing, hot foods and drinks will release tiny bits of mercury in there because it's all about heat and friction. If you apply heat and friction to an amalgam filling, it's going to release some mercury vapor. And it doesn't really wear out over time because the half life of mercury in the fillings is about 50 years.
Okay. Hmm.
So you're going to have some mercury exposure your whole life with those fillings. And the mercury likes to just kind of sit and hang out in typically organs and fatty tissue in the body. So if we're talking heat and friction increases your exposure to mercury, then if I'm a very well-meaning dentist and it's just time to replace one of those, and I take a drill to that tooth, think about how much heat and friction is then applied to that tooth while I'm removing the filling. So not only am I getting exposed
Mhm.
and my assistant is getting exposed, but you're getting this massive, huge exposure to mercury during the actual dental procedure to replace the amalgam filling. And so for a while there were people who were very well-meaning, saying, okay, we think these fillings might be a problem. Let's go ahead and switch them out. And then patients would just do a tailspin afterwards. If they were already
Mhm.
struggling with some chronic illnesses, they would kind of go off the deep end once they had their amalgam fillings replaced because they had just this huge exposure during the procedure itself. So there are a couple of organizations who created protocols that minimized these exposures to as low as possible. I don't think the exposure will ever be zero, but much, much, much lower. And so if anybody listening wants to look up the procedure itself and how to find a dentist who uses this procedure, it's just SMART.
Mhm.
And it's the acronym for Safe Mercury Amalgam Removal Technique. And so you can look up smart dentist or smart dentistry or anything like that, and it will send you to the organization that created these protocols. And you can search for a dentist who's close to you who uses these protocols so that we can make sure that when we're removing these amalgam fillings, that we're having just minimal exposure. And then you can go on and continue with whatever detox you're doing, with whatever functional medicine protocols you're doing, and move on from there. But we absolutely want patients working with someone first because I really think the timing does matter.
Mhm.
And for one, I'm not a physician. So I can't tell you, as a dentist, I can't say, hey, I feel like these amalgam fillings are causing X, Y, and Z systemically. I can't say that. Um, all I can do is treat what's going on
Yeah.
between your lips.
Hmm.
Yeah, in the mouth. Um, and so I'll have some providers who want to, they see heavy metal toxicity in
Hmm.
their patient and want those heavy metals out so that then they can do whatever kind of heavy metal detox or whatever kind of chelation therapy that they need to do for that patient. They need the metal out of there first.
Hmm.
And then some will say, absolutely not. I've had practitioners, and I'm thankful when they do this, who have put the brakes on that procedure because they'll say, okay, this patient's just not ready.
Hmm. Yeah,
Like we've got to,
you have to have be detoxing from a place of strength. So sometimes if you're not in a
yes.
place of strength, then the extra exposure can cause worse symptoms.
Yeah, yeah. So we got
Hmm.
to get, they want to get their gut in a better place.
Hmm.
So they've got to get their liver functioning better first.
Hmm.
And so it's important to know those things and be working with somebody that can help you through that.
Yeah, thank you. That's very helpful because I know that is something people get nervous about both ways. It is like if you have them, how are you exposed, and then what do you do and do it safely? So, and that you gave a great tip. Everyone can search SMART.
That's
That's a good acronym
a
for
good
that.
acronym.
Yes.
Yeah.
I know. Well, can you give us if someone's walking away from this, what are just some tips? You've provided so many helpful tips. So we're gonna, pay attention to fluoride levels, really think about water filtration, switching out your toothpaste, getting xylitol in 5 times a day. Are there any other things you would recommend just for someone to start out if they're looking for a more holistic journey?
I would say I do think it's important to find a team that listens to you and that you trust.
Hmm.
I personally think that that's better with a biological dentist, somebody who shares the same values, but at a minimum, um, don't be scared to go. Or if you're scared, go anyway. Um, uh, and find that team of practitioners that you connect with, that listens to you, that listens to your concerns, that you can really collaborate with to help you get well. Because we all want our patients to get well. All of us do.
Yes.
But sometimes if the values are so far apart, that it's hard for anybody to get good results.
Hmm.
If like let's say you're very, very holistically minded, you've never used fluoride, um, and all the things like I could go off my list of my crunchy patients who are like the ones who don't want any x-rays. Like if you're that person and you're trying to make it work with a dentist who wants to push x-rays every single visit, who gives you a guilt trip about not doing fluoride treatments on your kids, then you're just not going to get the best results.
Hmm.
You're just not. Um, and then you've got this struggle going on in your head that dentists are bad, you hate the dentist, and you've got issues with your mouth, but you can't go to a dentist because you don't trust dentists. So I would say do the work to find somebody that you trust that you can really work with and know that you absolutely can get well. You don't have to have tooth decay. Your kids don't have to have cavities. You don't have to have gum disease. Know that you've got the ability to get well and to heal yourself.
Thank you. Thank you so much. Well, can you tell everyone where they can find you?
Yeah, absolutely. So I'm in the Dallas area and I would love to see you in person. My practice, you can find me at www.flourish.dental. So find me online on Instagram is probably my biggest social media channel. So at Dr. Tony Ingram is my Instagram, and you can find me there. If you can't come see me in person, I do have an online course and a group program for those who just can't make it down.
Well, thank you. Thank you so much for joining us today, Tony.
You bet. Thank you.
Absolutely. Have a great day, everyone.